A warm smile evening for this Monday series from Joshi's Kerala group and with Guruma Bhupinder ma'am, international gold trainer for ISA, International Sujok Association, is with us every Monday for this wonderful Monday series. So let us all give a warm welcome to our Guruma Bhupinder ma'am. A warm welcome to you, ma'am. And today, ma'am is going to talk about or discuss about and give treatments on ENT, ear, nose, and throat. And last session was about tongue, and now it is about ENT. So I request everyone to please keep your notebooks, pens ready, just jot it out and keep your ears, eyes, and mind open for this session, please. And please don't fill the chat box with all your messages. Instead, you try to listen to ma'am very carefully so that you can jot it down. Okay? So, a warm welcome to all of you. Ma'am, from all of us, our hearts, minds, eyes, ears open to you. So, please take over the session, ma'am. Thank you.
Thank you so much. Thank you. Smile evening to everyone. Okay, so today we'll talk about ear, nose, throat problem. It looks simple, but you know that if some ear pain or throat problem, nose problem, so that time it is very difficult situation. The best part is that Sujok can help quickly in this problem, especially when problem is just started. Yes, in recent problems, Sujok, if you do Sujok, very first day, not only first day, but in within few minutes you can see the result. Yes, but if problem is chronic, then of course you have to do for few days continuously. So I'm sharing my screen. Just a moment. Share screen. Okay, I don't see this share screen. Okay, just a moment. Hmm. Yeah, it's especially children. They suffer very often from this problem, and also in change of season, you will observe this problem. Now, when problem is chronic, if it is nose problem or throat problem, chronic problem, it is very good to treat all these three areas: ear, nose, throat. So, all three areas, if you treat uh, in a combined way, you will see very good result. So, we'll talk one by one. First, let us take ear problem. As I told you, this problem looks very simple, but patient who is suffering from this problem, for example, ear pain, for him, it is a very difficult situation. So, if person has ear problem, especially I want to talk about babies also, small babies, they cannot speak. And if you find them crying, of course, you would like to do first aid before you go to the doctor because babies cannot tell. So few points you can focus. Like you can give massage to ear point, you can give massage to abdomen area because sometimes a heaviness in the abdomen, yes, some gas or because of excess feeding, baby can feel discomfort. Yes, so ear pain while feeding milk can go in the ear. Yes. So you can give massage on the ear point. If nose blockage, stuffy nose, then along with the ear point, you can also treat nose point. Now, where is the ear point? So in Sujok, we have basic system, insect system, Also, in many system, we can see this point, but it is very good for beginners to treat on basic system and insect system, and it will give very good result. Now, this is ear problem, and in basic system, thumb. This thumb is having ear point. Yes. Now, uh, we have left hand thumb and right hand thumb. If person has left ear problem, then it is very good to treat left thumb. And if person has right ear problem, then you treat right thumb. Okay. So first I will show points on picture. Then I will do practical treatment on my hand. So in basic correspondence system, this is ear point. Yes, in this area, we have to stimulate the point. And then here also, here you can see clearly ear point. Yes, because eyes, nose, mouth, and here you will find ear point. Yes, so I will show how to treat. Then in insect system means all fingers are representing full body. So this phalange, top phalange of each finger is representing the face. Yes. So the yin yang line, this is yin yang line, this part. So in this area, you will find ear point on all fingers. This is simple point, but it can treat difficult disease, not only ear pain, but tinnitus, for example. Yes, in old age or middle age, tinnitus problem. Then, if you can succeed in finding the painful point and you do acupuncture on that point, 4 needles on that point, you can see very good result. Only thing is, we have to select the finger which is showing the most sharp pain, that finger we are selecting for our treatment. So according to basic system, this is ear point here, and in finger system, this is the ear point here. Yes. So you can see in finger, top phalange is face, middle phalange is chest, and this lower part is abdomen area. That is why all fingers will have same presentation, same. So this finger, this pattern, you will see on all fingers. As a result, all fingers are having ear point. Okay. Now, where is the um, also meridian part? Okay, I will stop this. Please don't scribble. Also, for treating ear, small intestine meridian is very effective. And where is the small intestine meridian? Yes, this part, how to do treatment, I will show on my hand. And meridian part, I will just draw for you.
Meanwhile, I request everyone, please don't put your hands on your screens, on your mobiles, please, because there will be scratches on the screen, which will be visible for everyone. So requesting all of you not to touch your screens. Thank you.
So this line is representing small intestine meridian. This is small intestine meridian on basic system. Now, according to 6 key, ear or hearing sense is controlled by heat energy. The small intestine meridian and heart meridian are representing heat energy. So, especially if hearing sense is poor, it means heat energy is deficient. So, this meridian can help in hearing problem. I always like to treat first yang because small intestine and heart meridian, both meridians are connected with hearing sense, but or yang meridian is the first choice in my practical part. Why? Because Professor Pachevu used to say that sense organs are windows of nervous system. And these windows are interacting with the environment, like eyes, senses, eyes, nose, ear, taste. So all these senses are interacting with the outer world, with the environment. And through these windows, all environmental or all outer world information is coming inside us. So that is why this is hetero style. This is hetero kind of thing because interacting with the outer world. So hetero is more closer to R. So you can work on R meridian, and of course, if you don't see the result, then you can work on heart meridian. So if person has poor hearing, you can try with tonification of small intestine meridian. Yes, so let's talk about this, and then I want to tell about tinnitus also. I have seen very good result with this. And then I will talk about triurgin also. In triurgin, how you can approach uh, hearing sense or ear situations. So if ear structural problem, like any problem in the structure of ear, then correspondence system is very good. Yes. And if hearing sense, if it is sense problem, hearing sense, then you can work on metaphysical energy system, meridian or triorigin, or you can combine. Combination is also very good because physical, metaphysical, it looks separate, but actually they are together. Yes. Now, small intestine meridian tonification in poor hearing sense. How to do? You have seen bar magnet. This is the bar magnet. See, this is the bar magnet. And on this joint, we apply bar magnet. So I'll make drawing of bar magnet. So first try tonification, poor hearing sense means white facing the nail. So you can see this bar magnet. Yes, white facing the nail. So this is a tonification of our heat meridian. If heat energy is generated, then it can really improve hearing sense because hearing sense is controlled by heat energy. If in middle age, old age people, yes, it is okay. It is natural if hearing sense is poor. But if young age, middle age, they have this problem, then it means heat energy is deficient. Yes, but it depends. In local area, heat is deficient. Only in ear, heat is deficient, or whole body level heat is deficient, that is further diagnosis. But as of now, you can try with this small intestine meridian tonification. Yes. And in case you don't see the result, of course, you have to put this bar magnet. Maximum you can put for 2 hours. But sometimes within 5 minutes, also you can see this result. That is why you have to pay attention to initial minutes also. You should not neglect. I have seen miraculous results in my clinical practice. Sometimes you can see wondrous change in few minutes, in few seconds. Yes, but maximum you can keep for 2 hours this magnet. Then, uh, after first application, then try to observe that how much percentage result, yes, patient is experiencing. Sometimes he can say 50%. It's okay, it's fine. Then along with that, you can do a correspondent ear point treatment. In some people, I have observed heart meridian tonification is working for poor hearing sense. Like first you try with this small intestine meridian tonification. And if you don't see the result, then you can work on heart meridian tonification. And then where is heart meridian? Actually, 3 lines are there on each finger. So you have to focus this corner line. This is heart meridian. And bar magnet placement is on this joint. Energy flows from leg to arm. You know this. Now, white facing the base joint, yellow facing the tip. This is called heart meridian tonification. Yes, don't forget that is why I'm drawing for you so you don't make mistake. This is heart meridian tonification, and you have to observe this patient. If he feels discomfort, then immediately remove the magnet and you just do the corresponding treatment. Though we have another technique also, because we can check another meridian. Yes, because here I'm telling from beginner's point of view. Yes. So you can remove if patient feels discomfort, immediately remove. And you can focus on the correspondence area of ear. Yes, so this is for hearing sense. Now, improvement of hearing sense. Now, tinnitus. Okay, tinnitus. In this, voice is ringing in ear, and this is giving discomfort, a lot of discomfort to patient. Tinnitus. So, what you can do, you first try sedation technique. Sedation technique means yellow facing the nail and white down. Sometimes you will observe that when you apply magnet in that time, this sound can aggravate. Sometimes aggravation symptom is also good. Professor used to say why? Because energy is speaking to you in this manner that this application you did it on correct meridian. Only thing is direction is wrong. So professor used to say immediately change the direction. So you have to be ready. If a patient says that my situation is aggravating, then you just reverse the magnet. Okay. So now you can start with sedation first. Sedation, yellow facing fingertip. This is called sedation technique. If in 15 initial 15 minutes, voice or tinnitus sound reduces, then you can continue this magnet for 2 hours and you remove after 2 hours. Yes. Next day, if patient says that I'm feeling better, then you can put again. Yes. And you can do this meridian treatment till the time patient feels good and perfect. Yes, you can do. And if patient says that no improvement at all, because we have different kind of people, patients' energies are different, and for all patients, we have different technique. Different technique. In six key, in tri-origin, we have to focus constitution also. But from beginner point of view, if you don't see result, then you don't do this treatment. Out of 10 people, 6 people will show result with this. Yes. So you have to add correspondent treatment also along with this. And 4 people, if not showing result with meridian, then you just focus your treatment on correspondence system, basic system, and insect system. Yes. Now, this sedation, you try and because you have to try on both meridian. So, yang meridian, if not working, then for tinnitus, you can work on heart meridian as a second choice. Sedation means we'll low down and wide near the fingertip. This is sedation. Okay. Then in triorigin, now I'm telling triorigin technique. Okay. Triorigin technique. Hearing sense. Which joint you will focus? First of all, this is the finger, Nuto finger in triorigin. And this is this top joint, hetero joint, is left ear. Homo joint is right. It will treat all problems of right ear. And middle joint, both. Yes. Now, if both ear, definitely you will do middle joint. So now let's say if a patient has left ear tinnitus, a lot of sound coming. Yes, this is disturbance. This is heterophenomena. So this joint is left ear, though we have a proper triorigin rhythm while doing color therapy. We have a technique, step 1, step 2, step 3, step 4. Yes. But for that, we should have a complete triorigin consciousness. But simple technique is that apply this dark blue color like a ring, all 4 direction. Yes, as if wearing a ring, blue ring on this joint, all 4 directions. So you color this joint with dark blue color. And what is the problem? Tinnitus. Yes, you can find painful point also, and then you can do seed therapy also on this joint. Idea is left ear problem, but if this problem is on the right ear, then this same color therapy you will do here. If both ear, then this color therapy you will do on this joint. Yes, and just wait and see. Hmm? Do it for one day and see. Sometimes you have to observe intensity also. Yes, uh, if 10% result you say, it means this joint will help. Idea is that you continue this treatment for few days. Few percentage improvement is a very good symbol for us. Okay. Now, this was tinnitus problem. But if patient has poor hearing sense is poor, Then you color this joint with red ring. So left ear, right ear, and both ear. Okay. And same thing, color therapy along with colors you can do after, because you have to keep this color for 2 hours. And in daytime, you have to put this color. After removing color, you can cover this joint with seed. Yes. And one metaphysical treatment and one correspondent treatment is a very good combination. Mean, I mean that in basic system and insect system, you do ear point, you do seed therapy on ear point. Along with that, you do one energy treatment. You can select one, meridian or triogen. Some people are very good with triogen consciousness. They can do triogen treatment. And some people, they are very uh, friendly. They are very friendly with meridian, so they can choose meridian. Okay. So this is ear related protocol. And now I want to focus nose. Nose. Very simple, but nose also can, because nose is the door. This is very special gate, entry gate for our oxygen. And 1 second, if closed nose, cannot survive. Nose blockage, polyp in nose, any problem, sometimes nose allergy, any problem in nose, we can treat. And also, I wanted to say ear pain before I go to nose. If ear pain, you can put blue color for pain. Left ear pain, then blue color here. Right ear pain, blue color here. And both ear pain, blue color here. Okay. Along with this, correspondent point on the yin yang line, searching painful point on all fingers. So immediately you can see the result. Immediately, ear pain, as I told you that babies, sometimes they cannot tell. So you cannot do color therapy because we are not very sure with babies. Maybe they have abdomen problem, maybe they have some other problem. At least you can do massage on these points for babies. Yes, don't do color. If they have ear pain and a baby is very much receptive to this natural treatment, without doing color therapy, just massage with your uh, thumb tip, this ear point. And if ear is the problem, he can feel immediate comfort. And still crying, it means you have to rule out this ear problem. It means you have to focus some other area like this. So now nose. Yes, let us first see where is the nose point, because I will tell you correspondence system points, the meridian, also triogen points. So where is the nose point? In basic system, this is the nose point here. For sinus, people sometimes cannot sleep also. This is a very difficult situation. Yes. So this is the nose point. And of course, we are always searching the surrounding points also. So in sinuses, very good, like before sleeping, you treat all fingers, and next day morning, you will see a good result. Sometimes forceful treatment means all fingers you can treat. Yes. So this is the area for nose. So nose point, this is finger system, and in finger system, this is the nose point. And same pattern, you will see this is the nose point. So on all fingers, you will find the nose point. So this is the place where we have to search painful point. And the black pepper seed you can fix. You can fix peas, dry peas. You can fix buckwheat seed, star magnet. Yes. So these are the nose point. Now, also let us see tri-origin joint. Just a moment. Nose problem. So we'll talk about meridian and also tri-origin joint. So which meridian can help? I will give you easy way. Actually, we have a technique to, we have 12 meridians and we have a technique to choose the meridian, because in 6 key we have structural approach, we have functional approach, yes, and also we have pathway approach, but I'm selecting the simple one. Large intestine meridian, you know, near the nose also. So, in 6 key, functionally, large intestine meridian is carrying wind energy. We all know that structurally large intestine meridian is carrying dryness energy. But 6 key also says that it carries wind energy functionally. So this is new information, but 6 key students will know this. Now, pathway also, you know, it is near the nose. So large intestine meridian can help nose diseases very effectively. So where is large intestine meridian? So this is large intestine meridian. Again, you can imagine 3 lines. So we have to choose this line. Yes. So this line near the thumb. So this is large intestine meridian. And on the yang side, energy flows from arm to leg. So actually, large intestine and lung meridian, both meridians can connect this nose situation, can solve this nose situation. So, but as I told you that I all for sense organs, I always like to work first on yang meridians. And if I don't see the result, then I go for yin meridians. So this is large intestine meridian. Now, if you see any expressive symptom, yes, like sneezing or some allergic reaction, inflammation in the skin, inside the skin of nose, yes, some blockage or sinus, or you see any aggravation symptom, expressive symptom, acute symptom, if you see, then you can do sedation of large intestine meridian as a first choice. This is Buell meridian. So how to do sedation? Yellow, placing the fingertip with paper tape. You will fix. I will show. You see, I hope you can see. Okay. So this is large intestine meridian sedation. So acute symptom of nose, try this. Along with this, massage all nose points, as I told you. Yes, nose points and then large intestine meridian sedation. And if this sedation is not giving result, you can try lung meridian sedation because opposite of large intestine on the other side, as a couple meridian, lung meridian can help. So where is lung meridian? I'll show you. Lung meridian. This is lung meridian. So again, you can imagine 3 lines. This side is lung meridian. This is the place. Sedation. Yellow color. Downward. And white. So first you will try this, and if no result, then you will try turn hand on the inside. This is lung meridian sedation. And then again, I want to say the same thing. After application, if patient condition aggravates, don't worry, just reverse the magnet. Okay. And after reversing the magnet, if patient situation improve, it is good sign. Then you can tell him to keep this magnet for 2 hours, or whenever situation is improved, you can tell him to remove the magnet. Yes. So this is aggravation situation or acute situation, but also some allergic reaction like this. Now, if person says that my nose is blocked, yes, or breathing, nose is suffering from this breathing, yes, breathing, cannot inhale. So this wind energy, lung meridian and large intestine meridian, this couple is also helping respiratory system because of energy, wind energy. So in this case, you can tonify tonify, then tonification, white on the yang side, white facing the nail, yellow downwards. This is tonification. And of course, no result, then you can work on lung meridian. First, work on yang and then work on yin. So, this is called lung meridian tonification. To improve smell sense. In COVID, people had this problem, losing smell sense. Yes. So we were advising this large intestine meridian tonification, and if no result, try lung meridian tonification along with nose point. Yes. And then where is nose triorigin joint? Let us talk about this. Okay. So in triorigin, this finger is controlling smell sense. So nose related problem. This is the finger. Homo finger, ring finger. Yes. Just like ear, upper joint of this finger connects the left nostril. This connects right nostril and middle joint, both. Okay. So actually, this joint can treat both nostril also, but it has more connection with left side. Okay. So let's say if person has some blockage or blockage in the nose, blockage. So you can do actually color therapy on 3 joint. Blockage, nose is blocked, cannot breathe. Okay. After doing correspondent treatment, yes, this is nose point, basic system, insect system, massaging. Blockage, massage technique is also very interesting. Do clockwise massage like this. See the direction how I am moving like this. So here, like this. Clockwise, like opening the energy of nose. So sometimes you don't need triogen. With this treatment, patient is improved. So nose is blocked. After doing this massage, then you can put color here. Block means strong homoforce. Red color here. Ring, as if ring. Yes, all 4 direction. Then red color here. 3 colors you will put. Middle joint, green color. So this will open the blockage of nose. Yes. But if also loss of smell sense, in that case also this color therapy is very good along with this correspondent point. Yes. So this is the joint. But if person has some allergy, sneezing, allergic reaction, and inflamed skin inside the nose, then better we put blue color, and in the middle, green color ring, all 4 directions. Okay. So this is nose. Nose. Sometimes mudra can also help if you know that which finger is controlling ear sense, hearing sense, and smell sense. Now this is throat. Throat. Throat in basic system. In basic system, this is the place for throat. We will do seed therapy here. I will show. And in foot, this is the throat point. And in insect system, just 1 black pepper in this area can heal. This is the throat point. And actually, throat problem, many reasons. Yes, in throat, we have, you see, windpipe is here. Here at the base, we have thyroid gland. Voice box is there. Yes, but hoarse voice, we can treat this place. So all throat problem, of course, thyroid. For thyroid, we have to do another treatment, and the place is this lower base of this phalange. But general throat problem, yes, hoarse voice, coughing, irritation of throat, then we are focusing this area. Yes, and in insect system, this part. In triogen also we can focus, but we have renting technique to reach the throat. But this point is good enough because in triogen, this joint, also this joint connects with the throat. According to insect system, this is throat. And in triagen also, this can connect with the throat. And one more area in triorigin, because in triorigin, neck is neutral, so nail can help. Let me show yang hand. Any throat problem, any throat problem, you can focus nail area. Pressing of nail is very good. Neck, according to triorigin, is neutral. And nail, this area in each finger is neutral zone. Massaging this area is very good for throat issues, neck issues. Yes. So you can also search painful point. I'm talking about triogen now. Yes, it is not insect system. Searching painful point. You can search. You can do color therapy on the nail. You can do deep pressure massage on the nail. You can rub your nail like this. So idea is to give attention on the nail. Okay. Now I will show correspondent treatment of uh, ear, nose, and throat on my hand. So I'm changing. To share my camera. Bright light, something please.
Yes, ma'am. Bright light.
Yeah, just okay now.
Please. Now it's fine, ma'am.
Hmm. First is ear point. Seeds. Black pepper. Also, we can use buckwheat seed. We can use green lentil. And we can use star magnets. Star magnet also we can use. So, here on the yin yang line. This is yin yang line. Here, this is the ear point. This side. See, this is yang surface. This is yin surface. And this is yin yang line, which is dividing yin and yang surface. So ear point. Same way in insect system. This is yin yang line. So why I'm showing practical? So that you can treat with confidence yin yang line and ear point. Same pattern on all fingers. Now, any ear problem, okay? Any, you take any ear problem. So, this point you should massage. Little deep massage, but don't create wound. You know how much deep, so that no wound on the skin. Massage nicely. And also massage the surrounding area. Sometimes you can find very sharp, painful point. Yes, after massaging several points, one or two points, maybe it is very sharp. So you stop there without before you fix the seed. First, you fix this point. Okay. So you, for example, now I'm searching painful point. Yes, this is just dummy case, not real case. For example, I'm searching painful point. And let's say this is very painful. For example, now, ouch, ouch pain. Stop there. And now treat this point first before putting seed. Stop there and then press, release. Press, release. Press. Or do rolling technique on that painful point which you found now. Like this. Sometimes you will observe that when you do massage on this sharp pain point, before you fix the seat, patient can tell, oh, my pain is reduced. Okay. So don't quickly put seed. That is why people don't get result. They quickly start doing seed therapy. You can use this paper tape. Because left ear problem, that is why I'm taking left hand as first choice. Yes. So this is my left ear. This side is right. So example is left ear. And if right ear problem, then you will follow the same technique. Now, seat. In inflammation or acute pain, I like to use buckwheat seed. But if you don't have buckwheat seed, you can use any seed actually. Black pepper has medicinal property. Green lentil also you can use, no problem. But we need a little, not a fenugreek seed because it will not create pressure. If you want to focus the particular point, then you can put just one seed also or star mac. After doing that pressing technique, you can just fix multiple seeds on that area like this, or you can, this is one technique, or you just pay attention to the main point. Black pepper on the painful point. You can add surrounding point to make it more, accurate. For example, center point is the main point. We'll touch the main point. And in insect system, this point, side point, this is ear point, ear point. Yes. So you have to follow the same pattern. So you have to check because we have many fingers. Check, check. Sometimes just press and check when you want to compare that which finger is having more painful point. So press, release. 2 times, 3 times you can do press, release, and then go to second finger, press, release, 2 or 3 times. And then you can ask your patient that he can guide you. He can tell you that which finger is showing more pain. Actually, this is very powerful treatment. Only thing is that if you succeed in selecting the correct finger, so we have to guide our patient properly so that he helps you in telling the correct point. If patient understands that this is the technique to find the painful point, yes, patient supports, then our treatment can show wonder. So, for example, patient said that, doctor, oh, this finger is having more pain. Very nice. You stop there. And now, because first step in first phase, you were selecting the point, you were comparing which point is more painful. So once this is decided, now don't put seat immediately. Stop. And now press, roll, or press, release several times. So we have to create or frequency electromagnetic waves. We can create these waves only when we massage for 1 or 2 minutes. Of course, you can give rest. You can see the threshold of patient. Definitely, you will see the result. If you do with patients, actually, it needs patience. If you're doing this Sujok therapy with patients, definitely you will see the result. With smile, with love. Yes. So this is how you can do. And in right hand also, same technique, same pattern, uh, ear point. Now the thing is that if person has left ear problem, you choose left hand first choice. If person has right ear problem, then you choose right hand as a first choice. And in more chronic, severe cases, we can also do the same treatment on foot. Now we'll focus nose. Nose. So when you divide this is center line, and you can divide this into 3 parts. Imagine, and then here is our nostril like this. Nose. And in finger, you can find the projection, little protrusion here. Yes, something is popping out. So this is the nose point. This you can see in your finger. So this one point, you will notice that this is popping out. There is a protrusion. Yes, immediately you can find in your finger. So nose blockage, nose problem, yes, some sinus problem. This is the area where you have to check one by one. Sometimes, like insect system, on all fingers, I use different kinds of seeds. Let's say in insects, in index finger on nose point. Of course, massaging you have to do it to save time. I'm not massaging because I had explained whether you do ear treatment, nose treatment, or throat treatment. But massaging you have to do accurately, perfectly. Accuracy is very important. This is nose point, black pepper. Then after massaging, green lentil and white dot eye of this lentil will touch the skin. Then sometimes I'm doing this variety of seeds because each seed has its own beauty. Buckwheat seed in all chronic cases after massaging. Buckwheat seed. Then star magnet here. Okay. This is star magnet. This looks interesting. So this combination also works very well. Nose point you can do with all uh, diseases like this. Basic system. And now this is basic system. And in sinuses, I have observed very good result with this. Basic system is little big. So I'll make a flower. And the center point will touch actually the main nose point. After doing massage, you have to do good massage. So you can sleep with this, and then next day morning, uh, you can remove. Yes. If severe problem, you can do on both hands. Actually, from beginner's point of view, I say you do all fingers. But if therapist is doing, therapist will, because therapist know how to find the correct point. Maybe for him, for therapist, just one finger is okay. But for beginners, it is okay if you do all fingers also. Idea is that we need to see the result. Yes, so no problem. Little bit discomfort of paper tape applying because of this application, little discomfort, but it's okay. Our main concern is to cure this nose problem. I have observed that this kind of treatment, once sitting, it clears. So even in sinus, blockage of nose, polyp in nose also, it works very well, but you have to do for few days. And if you're doing regular treatment, then better that you give rest also to one hand. For example, you did left hand today, tomorrow you do on right hand and vice versa. So alternate days. Okay, so this is good. And then you can add food also. Now I want to talk about throat. Just give me a second, I'll remove this. Now, throat problem. This is the place. Black pepper works very well for general routine throat diseases or hoarse voice or coughing or throat irritation. Yes. So, and if you add this tonsil treatment also of coughing, some throat infection, sometimes infection is very severe. In this case, along with throat, treat ear point, as you have uh, seen in previous lesson, ear point and nose point. All this area treat, or you can do like this, ear point and throat on thumb, and nose you can do here, so that you don't create traffic here. Okay, so all severe infections of throat infection, better you add ear treatment also. Ear treatment and nose treatment. So for all throat diseases, after doing good massage, nice massage, you can do black pepper. For hoarse voice, before you apply black pepper, you can do moxa. But for inflammation, acute problem, don't do moxa. So after massaging, fix the seat. And if throat problem, then also massage this tonsil area, this point and this point. You can put additional seeds also, one black pepper here after massaging and one black pepper here after massaging this side. Hmm? And on insect system, this insect system, after massaging, this point, like this. Of course, you can check all points. This is throat point. This is nose, so ignore this. I'm talking about throat now. This one, throat point. Just one point can heal coughing immediately. Only thing is which point is painful. Fix seat on that painful point. You can check this hand also one by one. Yes. So this is how you have to do it. And meridian treatment already you saw. Triazole treatment also you have seen this. Okay. Now, do you have any question related to this ear, nose, throat? You can ask.
We request everyone to please switch on your videos when you're asking doubts, please. And whoever have questions, please raise it now itself, not at the last closing minutes, please. Rajeshwari ma'am, please switch on your video. Yeah. Once again, ma'am. Unmute yourself, ma'am.
Hello.
Yes.
Good evening, madam. Very nice
Good
session. We got very good information about the ENT. So your training has given to cure ourselves itself. Very good session, madam. See the tonsils and DNS, deviated nasal septum adenoids, the same protocol we have to follow.
Yes. Tonsils, you have to add those 2 points. And for adenoids also, along with the throat, you cover ear area because it is here, back of ear, near this
Okay.
area, nearby. Yes.
Show in the
Actually,
hand, madam.
yes, it is when you go open mouth, it is very deep. So I'll show. So in this, when you treat tonsil area, then this is the ear point,
Yes, ma'am.
So when you massage the surrounding area of ear, you will touch adenoids.
Okay.
Okay, and tonsils, you know, where is
This.
tonsil? Yes, ear point also you know. And when you massage the surrounding of ear, it will touch adenoids and tonsils. This one, it is very effective. You can put, if it is very acute condition, on one hand you can put black color, and on the other hand you can apply this seed. This you can fix liquid seed or black pepper because it has medicinal property.
Okay,
Yes.
madam. Then DNS, madam, deviated nasal septum.
Yes. So for that also you saw my steps, how I did it on nose.
Yes, madam. That same protocol.
Same. Yes, because now we are not doing with energy diagnosis as per 6T. It is, we have a very simple approach. Just start doing it. Try to find the most painful point. Check all fingers. And if your point is correct, very first moment you will see, patient will immediately tell, I am feeling little better.
Okay. Okay. The black color you told, madam, we have to apply in the throat surface.
You can apply on the throat, yes.
Yes. Thank you, madam. So kind of you, madam.
Good evening, ma'am.
Good evening.
You are looking good with the red dress.
Oh, this is yours. I see
Ma'am.
beauty.
Ma'am, past 5 years now, ma'am, I'm having right ear. I feel like watering in the ear. No pain and all, but I feel there is a water inside.
Yes. Okay.
No
You
sound,
just,
nothing.
no sound.
No, that means
Hearing
not
is
fingering
okay.
sound, nothing. No, hearing is okay. Here, no
Okay.
hearing problem. Only I feel there is a water collection inside. In that time, I have to put buds in that and to wipe that. Otherwise, if I not do that again, I'm having that below the ear around it's paining. So then I'll give massage here, and in the front of the ear, I'll give just massage. But
Okay.
for some time it will be okay for that, mama.
So in this, you have observed how I did ear treatment.
Yes, ma'am. Yes,
Now
ma'am.
I tell one color.
Okay,
On
ma'am.
that correspondence area of ear point, you just apply green color.
Green, dark green, ma'am.
Dark green. And on one hand, you apply green lentil seed or star magnet on ear point.
No, I don't have star magnet, ma'am. I'll apply green lender.
Okay. You can also try black pepper.
On both hand.
One hand green color, second hand, other hand seed.
Green lender seed.
Yes. Or black pepper. You can change. As I told you that I like to use all seeds. So
Yes,
don't
ma'am.
fix one seed because each seed has its beauty. Very
Yes,
beautiful.
ma'am.
So
Yes, ma'am. Thank you, ma'am. Thank you so much. Smile evening.
smiley.
Please unmute, ma'am. Fatima. Fatima. Please unmute. Yeah, please speak.
Okay. Thank you. Good evening, ma'am. I can't see.
Good
I can't see,
evening.
ma'am. Good evening. So
Good evening.
nice.
I
So
can
nice.
see you.
You can see me. That's right.
Yes, I can see.
Very nice. Very nice session. Mom, I wanted to know, my both while I was trying to press over here, my little finger around the nail and the ring finger around the nail, I have pain. Top everywhere I have pain. Yeah, I wanted to know, do you think I have to put black pepper
But
over
for
here?
which problem? For which problem? What problem you have?
I have blood pressure. Blood
Oh,
pressure.
you have. Oh, this session is about ear, nose, throat. You have blood pressure.
Yeah, I
Okay.
have blood pressure,
So
but
for blood
no,
pressure,
I did not know. I did not know. I just was following you. I pressed, so I noticed that I have this.
You just tried, you just pressed.
Yes.
Yes, general pressure
Pressing.
without focusing disease. You just did general pressing
Yeah.
around the nail.
General.
General.
The
Okay, no
the,
problem. You just fix the seat and let's see what change you experience.
okay, thank you. And I wanted to ask you about the thyroid, hyper or hypo. What treatment can we give?
We can, okay, thyroid point. There is a video also I will send thyroid. Yes. So
Okay.
thyroid, it is actually here, the base
Yeah,
of this
I know.
thumb. You know this area?
Yeah.
For
Yes.
yes, for hypothyroid, you fix, you do red color therapy here in this base area. You just color this area with red.
Right. Whole or only this the yin side?
Only inside. And
Okay.
if it is hyper, then
Yes.
dark blue color.
Okay, thank you. Do you have to put seed also, or only the color
On
will
the
work?
other thumb, on the other hand, you put seed. I'm doing like this. One hand color and the second hand seed. Like this, I'm making combination.
Okay, great. So nice of you. Thank you very much. Thank you very much. Okay. Bye.
Smile evening, ma'am.
My evening.
Ma'am, I want to give you my feedback on tooth class. You told to press on nail base. I have severe sensitivity. Applying this pressure, I am feel relaxed.
Oh, wow. Very good. Thank you
In the
so
class
much.
only. In the class only.
Oh, very good. I'm
Thank
so
you.
happy that you practice. That
Yes.
is why I show step by step, slowly,
Yes.
slowly. I do practical with this
It's very,
intention that you.
very easy to understand. Thank you so much.
This
And
is
one
my
more,
purpose.
no, ma'am, we are very glad.
Thank you. Thank you so
One more
much.
thing, ma'am. Due to heat, my son has sinus issue. So same
Mm,
protocol I have to apply.
yes. Now you start applying this. All points. You do multiple points. Do on insect system and basic system.
Okay, and infection due to pollen.
Okay. So you can do, this is nose finger,
Yeah.
then a blue color on top joint and blue color ring on the bottom joint and green color ring on the middle joint.
Okay.
Along with this, you do this colored therapy
Okay, ma'am. Okay.
and multiple nose sinus points.
Yeah. Okay.
Yes.
Hello, ma'am. Good evening.
Hello.
Yeah,
Good
nice to
evening.
see you. Yeah, nice to see you again. I just wanted to check for vertigo. Do we need to do the take care of the ear points?
It is good that you treat ear points along with brain point. Actually, in vertigo, you treat brain point, ear point, and cervical ear.
Cervical. So
Yes.
that's okay on at the back side of the thumb.
Yes, cervical.
Yes,
There is
the
a video
cervical.
also.
Yes.
Cervical area, and ear point, brain point.
Brain point. Okay.
You can, like cervical, you can do here, and brain point or ear point, you can do here, so that it is
Okay.
clear.
And
Yes.
also the foot, also we can read the foot as well.
Oh, it is. I like very much because, Sujok. Su means hand and jok
Yeah.
means foot. So, Sujok. Su plus jok.
Yeah. And for the phlegm, do you think it is the phlegm in the throat? Do you think it is because of the heat energy is not enough in the body, or?
No, no, no. It depends actually. Sometimes because of excessive humidity, as yes, sometimes heat, it depends. We need to check. But along with that, you can press the points of lung.
Okay. Okay. Thank you so much, ma'am. Hope to see you.
Yes, thank you.
Soundri ma'am, where are you? Are you there? Soundri ma'am, please unmute.
Yeah, I can. One second.
This is the sound ma'am.
Okay. Yeah. Yes. Can you hear me, ma'am?
Yes,
Yes.
please continue.
Okay. Thank you, ma'am. Thanks for nice session. And happy to see your face again. And I have one question, ma'am. Since you are talking about the ENT, I wanted, I don't know, I have a toothache. Is it okay if I ask you a question?
Yes.
Okay. I have a toothache, ma'am. The big one is kind of, I'm getting pain. So which point I should, press, or I should?
Did you see last time last session on toothache or teeth gums issue?
No, sorry, ma'am. Sorry, I was
So,
traveling.
so you have to wait with smile. Maybe in near future you
Okay,
will
if
get
it
that
is in the
video.
last session, then I can
Yes.
refer it.
I explained that part, and a lot of information is there actually in that session.
Okay. Yeah, thank you so much.
Smile evening, ma'am.
Smile evening, Meenuji. Smile. Nice to see your smile. Very joyful smile.
Ma'am, my son is sneezing so much, ma'am. Then I apply Triorison, ma'am.
Your voice, please say again.
Ma'am, my son is sneezing so much. Any dust, मतलब मिर्च मसाला खाने से भी वो बहुत ज्यादा छींकता है मैम.
Sneezing.
हाँ.
Liver point along with the nose point. Treat lung and liver point. Nose point and with nose. And I told you to check today I told you large intestine meridian and lung meridian. Try that meridian.
Yes.
Try that meridian. And in correspondence system, also pay attention to liver point and lung point.
Liver point, ma'am. Which liver point, ma'am?
Liver and lung point in basic system. You can see in our previous session videos, it is already there in YouTube, lung point and liver point.
Liver. I know liver and lung point, ma'am. Liver and lung point, which point, ma'am? Means sedation, tonification?
No tonification, no sedation. You have to do correspondent treatment, level 1 type of treatment.
Okay, ma'am. Okay, ma'am. Okay, ma'am. And my second question is, ma'am, when I go to the flight, ma'am, my ear pain is so much.
Oh, okay. In flight. You
Flight,
mean
ma'am.
to say in flight? Okay. Now, before going to flight, this time,
Yeah,
whenever
ma'am.
you go whenever you go next time, just apply ear point before you go. Massage and apply and then check. And then keep
Okay,
pressing
ma'am.
when you are in the plane. Keep pressing.
Ma'am,
Actually,
I pressing but not result.
you do clockwise massage now this time. Nice clockwise massage on the ear point. With the probe, do good clockwise massage.
Okay, ma'am. Okay, ma'am.
Prashant sir, please unmute. Yeah, please speak.
Good evening, ma'am.
Good evening.
I am Prashant Sharma from Ghaziabad, UP. I'm calling. Hello.
Hello, yes, I can hear your voice.
Please ask your question, sir, fast.
जी Ma'am, can we use Biol magnet for sedation or tonification?
Yes, we can use.
Okay,
We can
thank you.
use. Yes.
Soundri ma'am, is this a second thing? Hello, Soundri ma'am, are you there? Please unmute Neeta ma'am.
Okay. स्माइल इवनिंग मैम
Smile evening.
मैम बहुत ही इंफॉर्मेशन अच्छा मिला है नॉलेज बहुत अच्छा क्लास था मैम मैम मुझे
happy.
स्नोरिंग के लिए स्नोरिंग के लिए बोलने का था स्नोरिंग के लिए कौन सा पॉइंट
Yes. Nose point. You are doing like she's asking about snoring. So what you will do? Okay, I'll show. This is good. I got many results with this. Just a moment, I'll show. Let me cut this. So nose point, yes? And then, yes, this
Throat.
windpipe, a straight
Windpipe.
line, like you can make chain with black pepper. Yes, 2 lines of black pepper here. Can you see like this? Can you
Okay.
see?
Yeah.
And 2 lines, nose, and then in this area, yes, in this area, fill this area with black pepper after good massage. So nose, windpipe, and this area fill with seeds. And in insect system, nose, and again line like this. Because in insect system, nose is, throat is here on the joint. So when you put, you can just put 1 line like this. See, black pepper chain until here. 2 fingers or 3 fingers from nose until here. Try this. Basic system I told you and insect system.
थैंक यू मैम
This will be the last question for today, please, as it's
Smile.
endless. Please continue.
Smile evening, ma'am.
Smile evening.
Ma'am, I have a confusion. What you have told for vertigo,
Okay,
brain.
I'll tell you again. For vertigo, in one thumb, you
Yes.
do brain point and ear point.
Ear point.
Yes, and you
Right.
can check ear point on this finger also. On
Okay.
the other hand, try to find the painful point on cervical area.
Cervical area. Cervical point on the other hand, and ear point and brain
Yes,
point.
Yes, it is not compulsory that. The only thing is to avoid traffic on this thumb.
Okay.
Otherwise, so many patient can feel discomfort. And also, I want to add in vertigo, pressing lever point is also very good. Massaging lever point, tell your
Yes.
patient to massage lever point is also
Yes.
very good vertigo.
Okay.
Add lever points.
Okay. Thank you.
Okay.
So Smile, thank you, ma'am, for this wonderful session on ENT, and gratitude from all of us, each one of us. And this recordings will not be shared except for Seek Therapy paid viewers. So please, I request everyone to start attending the sessions and don't depend on recordings, please. So thank you so much, ma'am, for coming for this session from all Joshi's Kerala group members. Thank you so much. Good night to you, ma'am. I'm unmuting everyone. Please share your vote of thanks. Thank you.
Thank you, ma'am.
Thank you, madam.
Thank you, ma'am.
Much.
Thank you.
Thank you, ma'am.
Thank you, ma'am.
Thank you so much, ma'am.
One question,
God
please.
bless you.
Thank you so much.
Madam,